Good afternoon, and thank you for being here today. And I want to thank Dr. Cantor for being here again. And he has some updates that he will go over in a moment. As you can imagine, we have a lot to cover today because of the winter weather, the ongoing response to the pandemic, and whatever else might be on your mind. We'll see in a few minutes. We did just complete a unified command group meeting on both COVID and the extreme winter weather event that continues to bring record low temperatures to large parts of Louisiana, along with snow and sleet and freezing rain. And in fact, overnight, the second system in 72 hours hit Louisiana. I was able last night to send a letter to President Biden making a request for a federal emergency declaration related to direct federal assistance and Category B assistance, which is emergency protective measures. And I was able to talk to the president on Tuesday afternoon and make sure he was aware that we would be making that request. And of course, I look forward to getting a response from him very soon. As of noon today, right at 125,000 Louisianans did not have power. And about 20,000 of those individuals had not had power since the 15th. And most of those individuals were in the Baton Rouge area in the North Shore, and Energy is working hard and believes that the vast majority of those people will have power at some point later today. There are currently 98 water outages across the state, impacting more than 245,000 people. And there are multiple boil water advisories that affect almost 1 million people across the state. The National Guard currently has more than 960 soldiers and airmen activated in support of emergency operations, and that number increases as it needs to take on additional missions that they are being assigned. Currently, they're coordinating with GOSEP to support both bulk and bottled water deliveries across the state. They have distributed thus far about 28,000 bottles of water, and I can confirm that water's gone to Willis Knighton in Shreveport, Christus in Bossier, along with sites in Oil City and more in northwest Louisiana. But we're also working on bottled water distribution sites in places like Lake Charles. And I was able to talk to Nick Hunter today, and he made that request. Obviously, the infrastructure in Lake Charles remains compromised from Hurricane Laura. And their water system is struggling because they have so many leaks on the private side of their distribution system, and many of those structures are no longer inhabited. And so keeping that water pressure up to serve the community has proven to be very, very challenging. And it's going to take some period of time, even after the cold weather lifts, for them to be able to make the repairs necessary. But they are doing things like shuttling water to their hospitals using fire trucks, for example, to make sure that they have the water necessary to stay in operation. And speaking of getting water to hospitals, I can tell you bulk water is being delivered as we speak by National Guardsmen using containers that deliver 5,000 gallons of water each. I know, for example, we have one of those containers in Alexandria right now at the Caprini Hospital. But we also have several that are headed to Shreveport. The National Guard continues to provide generator support as well in Grant Parish, Wynn Parish. I have a request, I think, now from Evangeline Parish as well. And we know that they are working as well with DOTD, for example. I'll get to that in just a moment. When we talk about power outages and cold weather, we know that a lot of people are doing everything that they can to stay warm, as well they should. We just need for people to be safe in doing so. And generators produce carbon monoxide, which is poisonous and it's lethal if you're not careful. And so please make sure that if you're using a generator out there that you engage in all the safety measures, such as ensuring that that generator never operates inside. It needs to be at least 20 feet from the house in a well-ventilated area, not in a crawl space or a garage, not by a window or a vent, for example. And then make sure also that you let it cool down before you refuel it. But we also are worried about individuals warming themselves by leaving the oven on and opening the oven door. And it's not made for that, and that can be dangerous as well. And so please be careful. I think Dr. Kenner is going to share some more information with you all in just a few moments. The roads remain very treacherous in central and north Louisiana. And so even if you go to 511la.org and you see that a road is open, that doesn't mean that you should be out and about. For the most part, in South Louisiana, along the 1012 corridor, the road conditions have been improved tremendously. But when you start working your way north, that is not the case. So we're still asking people to be patient. Stay off the roads in central and north Louisiana unless it's absolutely necessary to get on those roads. There's still a lot of ice and sleet and snow, and we have overnight temperatures tonight are going to be at or near record lows in North Louisiana again, and actually even colder tomorrow night. So this weather system is going to be with us until Sunday. Sunday will be the first time that the overnight lows don't get to freezing anywhere in the state of Louisiana. And so that's when conditions are going to improve. And there will still be work required on the other side of that to make all the repairs necessary to infrastructure, especially to our water systems. DOTD's been working around the clock to get more roads passable. Obviously, ice continues to be a problem in many areas. As of this morning, there were still 57 weather-related road closures across Louisiana. I-10 and 12 did open yesterday at around 2 o'clock. I-110 in Baton Rouge is now open. I-20 is open technically, but it is still in very difficult, I should say it's very treacherous in terms of the conditions with the ice and the snow that remains on the road. And we also have issues with a number of commercial vehicles, 18-wheelers, that have stopped and on the side of the road, and in a couple cases in the roadway itself. And we're working to move those and get rid of those obstructions. And in fact, the National Guard has 5 wreckers that it is bringing to I-20 and working with DOTD and the state police to try to clear those roadways. But that situation, especially along I-20, is going to be evolving. DOTD continues to receive salt deliveries and is using the equipment that they have to spread salt and brine in order to try to de-ice roads and bridges as they are able to do that. In southwest Louisiana, DOTD was able to keep at least one lane of interstate traffic open in each direction throughout the event. Please remember that ice is not only dangerous to drive on, but it's also dangerous to walk on as well. We've unfortunately had 2 deaths related to individuals slipping on ice. One, I believe, slipped on ice and drowned in a pool. Another slipped on ice and had a fatal head injury as a result. The third confirmed death was due to exposure for an individual. And as of right now, we still have a total of 3 deaths that have been confirmed by coroners as winter storm related. And before I get to COVID, I did want to speak to just a moment about power. We know that the electricity companies have been asking folks here in Louisiana, really this is happening across a big part of the country, to conserve power. We've had a few rolling blackouts over the last few days, and the biggest issue with those were the fact that there just wasn't advance notification that they were going to happen. But at the end of the day, those actions were taken in order to prevent the possibility of a catastrophic failure of the grid which would be obviously much more problematic, especially when you had a second weather system coming in on the heels of the first one. But it remains important for people to know that conservation is critical if we're going to avoid having more load shedding events, these rolling power outages in the future, especially with record low or near record low temperatures tonight and even colder temperatures tomorrow night. And the periods of time when the energy companies are asking for your help in conserving are between 7 and 9 a.m. in the morning and between 7 and 10 p.m. at night. So if you can, and this does not apply to elderly folks and so forth, but if you're able, set your thermostat lower and just put on a sweater. And don't do your dishes and your clothes and that sort of thing during those hours. And if you do, please try to wash with cold water. But it's 7 to 9 a.m. in the morning, 7 to 10 p.m. at night, and that's going to remain in effect for today and tomorrow and for Saturday morning. After Saturday morning, we shouldn't have any more need for that in Louisiana, but it remains really important. Getting to COVID now, we're going to talk about today's update and an announcement regarding vaccine eligibility. We have received some good news over the past several weeks, and then again this week with doses being increased that in terms of the allocation coming to Louisiana. And this most recent increase, the previous increases have been primarily on the Moderna side. This next increase coming next week is on the Pfizer side. Now, that's the good news. The bad news is the shipments coming in for this week have been delayed. And the White House talked to us about this on Tuesday. And that's for a variety of factors. Employees were having a hard time getting to the pharmaceutical manufacturing sites in order to package things up. But then you had winter storm affecting closures at various airports where the distribution occurs. And so our large shipments of Pfizer and Moderna for this week, which normally would come in on Monday and Tuesday, haven't yet arrived. And so we expect to get those shipments. We don't know when. It could be Saturday or Sunday. And then Monday or Tuesday, we should get what would have ordinarily come on next week anyway. And Dr. Cantor is going to talk more about this. But bottom line is we're going to have to double up next week as best we can in terms of the number of doses that we administer in the state of Louisiana. But the good news is that the weekly allocations are increasing. We have at least 3 weeks of visibility on that now, and we've been told that those are minimum planning thresholds. And so we're more confident than ever that we can expand the number of Louisianans who are eligible currently to be vaccinated. And so I'm announcing today that this coming Monday, not today or tomorrow or Saturday or Sunday, but Monday, Phase 1B, Tier 1, will be expanded to include teachers and support staff working on site in a K-12 school, but also staff at daycare facilities as well. In addition to that, individuals aged 55 to 64 with at least one of the conditions listed by the CDC is placing them at an increased risk of severe illness from the virus that causes COVID-19. And then finally, we're adding all pregnant persons. So this is an additional 475,000 people by our estimates that are being included in the current order of priority, again, starting on Monday. And the lists, because I mentioned that age 55 to 64, you're going to have at least one of the conditions. Those conditions are cancer, chronic kidney disease, COPD or chronic obstructive pulmonary disease, Down syndrome, heart conditions such as heart failure, coronary artery disease, and immunocompromised state, weakened immune system, for example, from a organ transplant, obesity, severe obesity, pregnancy, sickle cell disease, smoking, and type 2 diabetes. So if you have one of those conditions or more of them, and you're between age 55 and 64, or obviously if you're pregnant, regardless of your age, you will need to fill out a copy of the Louisiana COVID-19 vaccine attestation form indicating the condition or conditions that you have for the vaccine that you are going to receive. The form can be found on the Louisiana COVID vaccine website. LDH is encouraging residents to print and fill that form in advance, but they're also working with the providers to make sure that it's going to be available on site as well. So this is very important, and as we signaled a few weeks ago, we intended for teachers and other school workers to be in the next order priority. We just weren't sure when that was going to happen. But being able to get to them is really important for our state. As we all know, they've been on the front lines of this pandemic, and they play a critical role in our continued recovery and obviously the education of our children. And we all appreciate teachers and support staff, daycare workers. I know I certainly do, and therefore very happy that we're going to be offering them vaccines starting next week. And I also wanted to thank Senator Cleo Fields for working with us over the last couple of weeks to make this happen in an organized fashion. We also know that older people and those with certain comorbid health conditions are at greater risk for having a poor outcome should they contract COVID-19. And that is why we are getting to those individuals 55 to 64 who have one or more of these comorbid health conditions. So the decisions we're making are consistent with the principles we outlined at the very beginning, and that is we were going to follow CDC recommendations, the ACIP recommendations, if you will, to the greatest extent that we could here in Louisiana, consistent with the overarching goal of preserving our hospital capacity and saving lives. And that is what we're continuing to do. And with respect to individuals who are pregnant, as you all know, we've had challenges around maternal mortality in Louisiana for many, many years. We've had a number of initiatives over the last few years to address that. This is a continuation of that, but also is faithful to the CDC's guidance that we should make the vaccine available to pregnant women. So if you are pregnant, you have access to the vaccine now. If you have questions, please speak to your doctor about that. But do get vaccinated because it is safe and effective. To date, we've administered a little more than 812,000 vaccine doses. And the last utilization comparison that I saw was in terms of the total doses administered, Louisiana was 11th in the country in utilization. And as for individuals who have received their second dose, was, I think, number 8 in the country. I don't know how that's going to shake out after this week with all the interruptions we've had around the country. But I mentioned that to let you know that our team here at the state, but also a lot of local partners in hospitals and clinics and pharmacies and so many others are just doing tremendous work in order to make sure people can get vaccinated as quickly as possible. As far as today's numbers, we're reporting 832 new cases on 14,338 tests. Very sadly, we're reporting 15 additional deaths. We're now at 9,406 deaths since the start of the pandemic. 823 patients are hospitalized across the state today with COVID-19. 128 of those are on mechanical ventilators. To put the number of folks in the hospital into perspective, we haven't been at this number since before Thanksgiving. So we have made a lot of progress since January the 8th. And I did want to express my appreciation to the people of Louisiana, because I will tell you, early January, we were in a very bad place and headed in just an awful direction. But things have improved because of the work that's taken place out there and people following mitigation measures and abiding by the restrictions, it's critically important. And while we're much improved, baseline numbers remain relatively high in terms of new cases, in terms of hospitalizations, and of course we're still reporting far too many deaths every single day. We do have 15 confirmed cases of the UK variant here in Louisiana. There are at least 32 pending cases, and likely many more than that across the state. And so my message to the people of Louisiana is quite simple. The UK variant is here. It is widespread. It is all over the state. And the CDC estimates that in as little as a month from now, it could be the predominant strain of the virus in the United States, and certainly here in Louisiana. The reason it makes a difference is because it is more easily transmitted. I think it's 50% more transmissible. And then there's growing evidence that you have a poor outcome on average if you contract this strain of the virus. So it's serious, but the good news, to the extent that there's good news, is all of the mitigation measures that are effective against coronavirus are effective against this one as well. Masking and distancing and washing your hands, staying home when you're sick, getting tested when you believe you've been exposed, and getting the vaccine when it is your turn. Speaking of testing, it wasn't just vaccinations that were interrupted this week with the severe weather that we've had. Testing has fallen off significantly. Nobody ever likes that. You always want to know what's going on with respect to cases when you're in a pandemic. Regions 1, 3, 4, and 9. So that's the New Orleans area, South Central Louisiana, Acadiana, and the North Shore. They have operational community-based testing sites. Tomorrow, we believe that community testing will be taking place in all regions except for 7 and 8. So that's that Shreveport over to Monroe corridor. So at this time, I'm going to ask Dr. Cantor to come up. He will make some remarks. As you always do, please address any questions you have to him when he finishes his remarks, and I'll come back after that, conclude mine, and then I'll take some of your questions as well.
Good afternoon. Thank you, Governor. Thank you for your leadership. And I would like to just open by thanking a lot of folks who are working hard in the weather right now to keep us safe and open the state back up. So Department of Transportation folks, police, state police, first responders. There's a lot of people out there trying to keep things going, make sure hospitals get water, National Guard, make sure nursing homes are taken care of. So my thanks to them, and also my thanks to healthcare workers in hospitals who, a number of which having to work double or triple shifts because they can't get out, or people that are kind of taking a slow commute in to relieve them. So sincere thanks to all those people who are working hard right now. I do want to start by talking a little bit about the risk to life that exists right now. And the governor mentioned a couple really important ones. As we see with disasters, and we certainly have our experience with those, there's the disaster itself, and then there are other things that can make a bad situation worse. And that's really what I want to focus on. The 2 of the 3 deaths that we had so far were theoretically preventable. There were people that fell. We know every time that we have an emergency like this where there's potential loss of power, there's the risk of carbon monoxide poisoning, which is another entirely preventable death. So that's the first thing I do want to talk about. The risk of carbon monoxide poisoning is real, and families need to know about it. Anytime somebody has a loss of power and is using a generator or alternative heating devices, they have to be very, very careful. Carbon monoxide is completely odorless, completely painless, and the only way you know about it inside your house before it kills you is if you have a carbon monoxide detector. That's the only way. It's a very silent killer, but every emergency that we have, it pops up. And just remember back to Hurricane Laura, when we had power outages in the southwest part of the state, we had a number of people, unfortunately, die from carbon monoxide poisoning. So I do want to ask families, if you're heating your house through alternative means right now, as the governor said, if you're using a generator, always outside, always well away from the house, well away from doors, windows, and other air intakes. And never, never heat your home with a kitchen oven or a kitchen stove. It does two things. It emits silent toxins into your house that you don't know about, and it also is a pretty large fire risk in and of itself. Those are two things that can help prevent making a bad situation even worse. Another thing I'll mention is I really, as the governor did as well, ask people, avoid traveling right now if you can avoid it by any measure. The roads are not very safe, and there's a lot of car accidents out there. If you can avoid going on the roads, it's better for your own protection. It also allows emergency responders and people hauling water to places to have a little bit more space to operate out there. So please avoid travel if there's any way that you can safely avoid it now. I do also want to mention for individuals who are dialysis dependent, these are people that live at home and take dialysis 3 days a week. If you live in an affected area, if you live in the Shreveport area or some other northern parts of the state, it is likely that your appointments will be affected because of the weather. Please communicate with your dialysis provider. This is the place where you receive dialysis. They will reschedule you. Please communicate with the dialysis provider. We want anyone that has to miss or postpone a dialysis session to get back in as soon as possible. So please reach out, proactively communicate with your dialysis provider. They will reschedule you. As the governor mentioned, because of the weather, and not just the weather in Louisiana, this is a national issue right now, a good number of vaccine deliveries, both first and second doses that we expected this week, are being postponed. And again, it's not just because of the roads in Louisiana, although that's a big problem. A number of the shipments never made it out of a central hub in other states because of weather or because of personnel shortages. So unfortunately, that's affecting us here. There are a fair number of people who were expecting to receive a vaccine dose this week who unfortunately are going to have those appointments rescheduled. For anyone who falls into that category, if you have an appointment coming today, tomorrow, or the next day, or if you were supposed to have one earlier in the week, please communicate with your vaccine provider. This is the clinic, the hospital, the pharmacy that you had an appointment with. They will let you know when you are rescheduled for. Don't forego this. Don't use this as an opportunity not to get the dose. The dose is still really important, but please just communicate these appointments will be rescheduled. If it was a second dose appointment that is getting rescheduled, that's okay. Reschedule it, take the dose. If it ends up being a week or even 2 or 3 weeks later, that is okay. It is still efficacious. It will still provide protection. The CDC says you aim for the right follow-up, the 21 days for Pfizer and 28 days for Moderna. You shoot for that, but if something happens to make you have to delay, like an unprecedented weather event, that's okay. It's still safe. You don't need to restart the vaccine series. So anyone that has a second dose appointment delayed because of this weather event, please call that vaccine provider, get it rescheduled. It is still beneficial to take that second dose, even if it's days or even a week or 2 later than it otherwise should have been. I'll give a quick heads up of where we are with doses we should expect next week. And as the governor mentioned, next week is going to be a high volume testing week. We're really going to be asking a lot of our vaccine providers next week because we have increased doses coming to us anyway because our allocations went up a little bit, and we're going to have a lot of doses that would have arrived this week that are going to come later this week or early next week. So we'll be asking vaccine providers to do a lot next week, as they've been doing the whole time, I should say. So next week, this coming week, will be week 11 for us. Two changes are happening with the doses we're getting. Number one, the Pfizer doses, starting with this coming week, this is a policy change by Operation Warp Speed, will be counted as 6 doses a vial. So we've known for a number of weeks now that with the right equipment and care, you can actually get 6 doses out of those Pfizer vials, even though they're labeled for 5. The company applied to the FDA to formally change that labeling, and that was granted. And Operation Warp Speed waited a couple weeks just to make sure that they had enough of the low dead space syringes to make it possible for every vaccine provider. They do now, and now any vaccine provider that gets Pfizer is getting a kit that includes those low dead space syringes. So starting with this coming week, Pfizer allotments will account for 6 doses a vial, which means the Angel doses that we have enjoyed won't be there anymore. So in terms of a vaccine provider, if they're being told they're getting, let's say, 100 doses, it's actually 100 doses. They won't be able to bake in a 20% bonus on that because it will not be 6 doses a vial. On top of that, our allotments are also going up a little bit next week. So it's not just an accounting increase, it's a raw increase as well. So the numbers that we expect to come in next week for Pfizer are 45,630. And again, that's an increase because of that 6-dose vial accounting and a genuine increase on top of that. And then for Moderna, it's 45,000 doses, giving us a total of 90,630. The other announcement to make on that is we are extending the federal retail pharmacy partnership program in Louisiana. We had brought Walmart on as a partner a couple weeks ago, and we'll be bringing on CVS as a partner this coming week. So I don't know offhand how the weather is going to affect the shipments that they would otherwise have expected on Monday, but CVS stores will start to carry throughout the state through this federal partnership. Those are doses above and beyond what our normal allocation is, and we will include CVS locations that have vaccine in the Monday morning updates that we put on the website. We're very excited about this partnership. Again, it's more doses coming to the state than otherwise would have come to us. The last thing I will mention is, as the governor had said, we're clearly coming down in the right direction from COVID. We peaked around the Christmas and New Year's time. We've made considerable progress now, and if you look at the epi charts, which are up to date on the dashboard right now, we've actually recovered almost all of the ground that we lost with this New Year's surge. We're almost at the point that we were prior to Thanksgiving, around the beginning of November, when we started to go up. We need to keep that. We need to keep going in that direction. So as of today, percent positivity for the state is at 5%, and there are only 46 parishes out of 64 in the state that are ranked as highest risk of community transmission by the CDC. That's an improvement, but it's not great. It's not great. We're going in the right direction, but just like we talked about the past 2 weeks, there still is a lot of risk out there. Looking forward with the variants circulating, and we know from what the CDC projects that the B117, or the UK variant that the governor mentioned, is doubling in numbers across the country about every 10 days. Excuse me. It's certainly possible that we have another spike in our future, and our goal right now, in addition to keeping yourself and your family safe, should be to drive transmission down as much as possible, so that if we do have another surge, we are equipped to weather it well, that we don't get ourselves too high. How high you get in a surge is very much related to how high you were when you start that surge. And this past surge, we started pretty high, and we ended up very high. We would like to do it a little bit lower. If at all, we have to do it the next time. So I will say, for people out there, there are 2 things that really should give people concern that you need to give caution towards right now. One is just the general risk of catching COVID out there, which, again, in 46 out of 64 parishes is the highest category possible by the CDC, even though we're encouraged in the direction we're going. And the second is ancillary risks with this cold weather. Driving on the road when you don't have to, slipping and falling, being careless with how you heat your home. Please be careful. We want to minimize any suffering that we have from this weather event. I'd be happy to answer any questions if there are any. Melinda?
In terms of the federal pharmacy program, how many doses are the Walmart pharmacies getting now? And when the CVS pharmacies come online,
will they be getting additional doses on top of what Walmart is already getting, or will you be splitting up the pool to more pharmacies?
Additional on top of that, what the feds did, the feds had an initial allocation for that retail program of about 1 million doses nationwide. They doubled that to about 2 million, which then goes through the same pro rata calculation, divvied up by states, by population.
So does that mean you get about 28,000?
We haven't, that's not confirmed. The Walmart's got about 14,100 last week. That was in addition to 5,700 that we seeded them with to start the program off. We believe that the CVS's will be in that ballpark because it's been another 1 million added to the national pot, but we haven't been confirmed with those numbers. And again, with the weather, I don't know exactly when they're actually going to be shipped. Yeah. Yes, Sam?
Before this week, we were going on a pretty strong trajectory in the number of doses we were administering on average per day, and that chart sort of plummeted as we got today's update, primarily, I would assume, because of the storm. I guess I'm wondering, it's tens of thousands of doses that haven't shipped yet. How long is it going to take us to catch up and make up for that lost time of this week where we didn't administer any doses?
I don't know. I wouldn't expect more than a week or two. You're right. We were doing really well. I mean, I think we still are doing really well. And this setback is not just Louisiana. A number of states are, really affected by this right now. There's no question that we, even today, have much more capacity to deliver vaccine in Louisiana than we have supply. I mean, supply really has been our limiting factor. So I think that our vaccine providers are going to do a good job next week with the added volume, essentially make up for lost time. It might take a week or two to get back to the rate as they build up, because they're also doing second doses with that as well, and some delayed second doses on top of that. So I would expect a week or two, but I think our providers are going to do a really good job because we still, we still have unmet capacity to deliver. We're still in a situation where supply is our biggest limiting factor. Yes, sir.
Can you give us an update, generally speaking, about lost doses in Louisiana? And then I know yesterday at least one person from LDH said they hadn't yet heard of any losses or waste due to power outages. Can you give us an update on that today as well? Yeah,
the number is 754 right now of lost doses, which is, off the top of my head, probably about less than a percentage point of the total doses that have been given here. We've not yet had any confirmed loss from this recent weather event. We very well might. There's a process that goes into this, and the first step when a provider reaches out to us with concerns that they lost power or something like that is we communicate with the vaccine manufacturer, Pfizer or Moderna, and they walk through what happened. There are some instances where, depending on the circumstance, depending on the temperature range, you can actually still use those doses. So that's the first step. If the manufacturer says you can't use it, then we work with the provider to do an investigation. So nothing of that nature has concluded yet, but it's certainly possible we'll have some pop up. Yes, sir.
So the governor said that 475,000 people will be added from, including teachers and school staff. So is that just the teachers and school staff, or is that the entire TOP?
That is inclusive of people that work in a K through 12 or daycare environment, plus people aged 55 through 64 with at least one of the CDC listed preconditions. Some of these are estimates, but it's a total number for those. Yes, sir.
More than 271,000 people have completed that vaccine series in our state. What's kind of that magic number of sorts y'all are looking at, along with kind of people who have already had cases, to kind of meet that level of immunity to get things back to normal?
A lot more than that. Probably somewhere around 65, 70%. Unfortunately, it does not appear that prior infection is definitively protective. And that's why people that had COVID in the past are still advised to get the vaccine, and that's why we're seeing a fair number of people have reinfections. So really, his vaccine is the prime way to do that. Again, ballpark 65, 70, maybe 75% of the population, which I don't think we're going to get towards until sometime, hopefully, in the late summer, maybe early fall, I would imagine. I don't think the number now with 271,000 is really enough to put a big dent on a population basis, but it surely means an awful lot if you're one of those individuals. And I do think in specific risk areas like nursing homes, for example, we should expect to see fatalities go down considerably because we've made so much progress in that. Yep, Melinda?
Can you give us an update on the vaccine program?
In terms of where we are in percentages?
Absolutely. So total doses administered in the long-term care facility program to date is 61,427. That breaks down for resident doses of 39,824, staff doses of 21,603. 100% of the nursing homes have now completed their first round visit, and the majority of them have completed their second round as well. There are 3 visits typically for each facility. Each facility receives 3 visits, each one 28 days apart. To date, in the nursing homes, 83% of residents have taken the vaccine, and 38% of staff have. 38. Mm-hmm. Yep. And Sam?
On this question, following up on that, we see like a pretty precipitous drop in hospitalizations. And we've now been vaccinating elderly people who are more likely to end up in the hospital for a few months now. I'm wondering if we're starting to see, these folks who might have otherwise ended up in the hospital, but for the vaccine. Do you think that's making a dent on our COVID numbers?
Yeah, I think it's possible, and I think that's by design as well. And you've heard the governor say a number of times now that with so many people hospitalized and with the fatality count so high, it's very important for us to be directing vaccine to people who are likely to suffer those complications, and that's part of what informed today's decision to extend it to those age groups who do have one or more of those underlying conditions. When you look at the graph right now, our incidence is going down as well, so I think it is a combination of those two, Sam. I think cases are going down because they're going down. We peaked and now we're coming down, and so hospitalizations follow. And I think we are beginning to make a dent in the people more likely to suffer complications. Yep, and last question. Yeah.
Public hearing part. Go to the next person.
Okay. Listen, everyone.
And please keep your eye on the ball the next couple of days. It's risky from a COVID perspective, and the weather makes it very dangerous as well. Please don't do anything to increase the risk of what already is an unfortunate situation. Thank you.
Thank you, Dr. Kenner. We in Louisiana, we're not accustomed to these extreme winter weather events. Thankfully, they don't happen that often. And this has been a very difficult week for our state and for much of the country. We are not out of the woods yet. We still have a lot of ice and snow on our roadways. We have electricity outages, and we have severe complications and disruptions with respect to our water systems. And further than that, tonight for North Louisiana, they will achieve record lows or near record lows. And then again tomorrow night, it'll be even a little colder. So this winter weather event is going to be with us until Sunday. Again, that'll be the first day where the low temperature nowhere in the state drops below freezing. So the longer the duration of an event, the more people who make poor decisions. And so just really want to encourage people to do everything they can to make the best possible decisions for themselves and their families, for their safety. Be patient, be safe, but also check on your neighbors. If you've got someone living next to you who's elderly or needs special assistance, please check on them and make sure that they're warm enough, make sure that they have something to eat. And please do it while wearing a mask and staying physically distant as best you can. And I'll tell you, Louisianans know how to be good neighbors, proven that over and over again, and I know that that's happening out there right now. Our next scheduled press conference will be on Thursday of next week. Obviously, if we need to speak to you before then, we will reach out to you and let you know that we're scheduling a press availability. So with that, Sam?
Governor, we're already going to be testing our capacity to deliver vaccines next week because of the winter storm, and now we're adding a whole new almost 500,000 people. I'm wondering, are you worried about a bottleneck where people aren't going to have access for a week, 2, 3 weeks, just because there's not enough capacity to deliver it? And also, could you clarify the teachers and the school staff, is that public schools or all schools?
All schools. It's all schools, and it's not just K through 12. It is preschool too, early childhood learning centers, for example. I have enough concerns to keep me awake every single night. We know that the disruptions in the delivery and administration of doses this week will complicate next week, when we were already going to get more doses than we've received at any point up to now. And then I checked multiple times with Secretary Phillips and others, is this the right time to add these new individuals to the priority group who can be vaccinated starting on Monday? And the decision is yes. The doses are available. We, again, are going to ask people to schedule those appointments, be patient, and understand that the providers are having to juggle a number of balls all at one time in the air as they try to catch up from the doses they were unable to administer this week and to administer next week's doses, which were, in some cases, will be the most that they've been able to receive. But it's also true that we've been saying we wanted to add people to the priority groups as we receive more doses. Well, we're going to have more doses to administer next week than we've ever had before. And so from that perspective, it is exactly the right time to add in individuals to the next priority group. But is it going to be as smooth as it would have been had we not had this winter weather storm this week? Probably not. And so I'm encouraging people to be patient, to call, communicate with your providers, whether you weren't able to get your first dose or your second dose if it was scheduled for this week. Follow back up with them, and then for everybody who's looking for a dose next week, who's in the priority group, please call and schedule those appointments as well. We're going to get through this. I have every confidence that within a week or 10 days, all of this is going to be ironed out, and we'll be back operating smoothly. And we're going to get a lot of people vaccinated over the next 7 to 10 days too. It just won't be quite as smooth, and we may have to be open later at night. We may have to do more weekend events and that sort of thing in order to catch up. Yes, sir.
Governor, your wife is obviously a teacher as well. How important was this to get teachers vaccinated for you?
Well, look, Donna was a teacher, and we've always prioritized teachers as a group in terms of the occupation because they're so critical to educating the children. But also, if school is in session, then parents don't have to stay home with their kids, and especially K through 12 and in the lower grades. Distance learning is not optimal, and there are more problems with that, and so forth. And then when you conduct in-person, on-site education, again, especially at these lower grades, it is almost impossible for teachers to remain physically distant from their students. It may be possible in high school. We know it's much more feasible in college. So for all of those reasons, and the Trump administration first, and now the Biden administration has asked states to prioritize teachers. And so for us, we always knew we were going to get there, and this is the order that we were going to take. We just didn't know when on the calendar, because we didn't know what our allocation of vaccines were going to be over time and what the uptake was going to be with the current priority groups. But this is the right time to do it. And I will tell you, if you were listening, I got a call from a teacher on my radio program on Wednesday asking about this, and of course I knew the answer, but I wasn't making the announcement till today. But so it is something that we've intended to do for a while, and I do want to thank all of the leaders in education in Louisiana for working with us on this, and I think it's the right thing to do, and I look forward, by the way, to expanding these priority groups over time as we are able to do it. Literally every single day, I get multiple emails or messages asking me to include some additional group as priority for the vaccine, and every one of those requests makes perfect sense. The challenge is you can't prioritize everybody at once, otherwise you prioritize nobody. And so we're being guided by the recommendations coming from the CDC, but also our own experience here in Louisiana as to who it is that's showing up in our hospitals most often. Who is it that is dying most often. And so that's the way we're going to tackle this, and we're going to continue to do that. And I make that point because I know that people are tempted to believe, well, if they're not in the current order of priority, then they're not important, or that I don't think that they're important. That's clearly not true. But next week is week 11. We just haven't been at this long enough with enough doses to work our way through the priority groups. I look forward to the day, and I know Dr. Fauci said the other day he thinks it's June, when anybody who wants one, regardless of priority groups, can just go to their hospital, to the doctor, to a clinic, or to a pharmacy and get a COVID-19 vaccine. And by the way, he backed it up to June not because there's going to be a delay in the Johnson & Johnson vaccine being approved, but because the initial allocations, once it is approved, will be smaller than they originally thought. And they're going to ramp up considerably over time with their manufacturing output. But initially, it's going to be smaller than they thought, and that's why they're saying June now until we reach that time period. Yes, sir.
Governor, a few minutes ago, you obviously talked about the need to conserve power and the issue with Entergy not necessarily putting up those advance notification of those rolling blackouts on Tuesday. Obviously, a bunch of those notifications via voicemail or text went out yesterday. When you spoke with Entergy officials after that first round of blackouts on Tuesday, did you discuss the need to give notification? Did you make it clear that was a priority, or that residents needed to not be caught off guard necessarily?
Well, I mean, I did. We discussed the entire episode and how these things happen. And of course, I had the benefit of having some discussions a couple of days before Tuesday about the possibility of load shedding through these rolling blackouts, if you will. But there are certain things about them that people need to understand. First and foremost, I want electric companies, whether it's CLECO or Entergy or SWEPCO, whoever it might be, to provide as much communication in advance of these events happening as possible. And by the way, I think they want to do that too. With respect to Tuesday night, they were not given advance notification. They were told, you have to do this, you have to do it now. And it was literally the case that I think it was 7:30 when I was notified by GOSEP that the Public Service Commission representatives had notified GOSEP that this was going to happen. Within a few minutes, I was on the phone with Entergy, but it had actually already started, and it lasted for a few hours. So the communication is critically important. I think people can accept better the fact that they're going to lose their lights if they have some advance notification about that, and they know that it's only going to last for 2 or 3 hours or whatever. But I do want people to know that this is not a decision that is made by local companies like Entergy or CLECO or SWEPCO. They're all part of regional associations that have to take these directions. And every now and then, when the demand on a grid exceeds the ability for the grid to sustain it, they have to do these rolling blackouts in order to prevent catastrophic failure. And that's critically important, because had we had catastrophic failure, then everybody loses lights for a long period of time, and we had these follow-on weather systems coming at us. And so what they did, they didn't have a choice. They had to do it. It was the right thing to do under the circumstances. But we all agree, and this includes the energy companies themselves, that more advanced notification would have been helpful. And I think you saw yesterday and today Entergy continuing to communicate about the possible need to shed load going forward, especially tonight when we have very low temperatures, and then again tomorrow night, and asking people to conserve electricity during those hours of 7 to 9 in the morning and 7 to 10 in the evening, to minimize the likelihood that may happen again. So, and as you know, if you're following the news across the country, Louisiana is not the only state, or even the primary state that's being affected by these load shedding events. Yes, ma'am.
On the same subject, one of the complaints
That seems to be common, is that people aren't getting any information from Entergy in particular about when restoration is estimated. Do you feel like you've been getting good information from Entergy about what restoration estimates there are? And do you have concerns about the lack of information that went out to the public about that?
Yeah, well, I don't want to say that I've been satisfied with the information that I've gotten from Entergy about power restoration. I will tell you that greatly improved today. So the Public Service Commission briefed at the Unified Command Group meeting today at 1 p.m., for example, that the vast majority of individuals who have suffered outages since the 15th, those outages will be restored before the end of the day today. And I think some of those estimates were as late as 11 o'clock tonight. And again, those outages are primarily in the Baton Rouge area, but extending over across St. Helena, Livingston, Tangipahoa Parish, and so forth. And we always want to know when the lights are going to come back on. And it seems like we get better estimates, or at least we get information about an estimate of restoration of power sooner after a hurricane than we did in this particular event. And these outages are very different, however. There are times after a hurricane where the companies know that when they do certain work in a certain location, it's going to restore power to large numbers of people all at one time. The nature of these outages, because of snow and ice, and by the way, it's primarily ice, it's not snow, which is why when that half-inch of ice formed in northeast Louisiana, all of a sudden you saw from Tensas Parish and Ouachita Parish and areas up there, the lights go out in broad areas, is because it happens in discrete locations, and you have to go out and do work at a lot of locations in order to restore power. And then the roads are a problem for them too, right? It isn't just the general public that can't get to where it needs to go. These crews can't get to the locations in many instances where the work has to be done. And so it's all very, very complicated. But I think whether you're talking about power restoration or whether you're talking about these rolling blackouts, communication is very, very important. And that was lacking initially. And I think yesterday and today it has gotten much, much better. And that's what we would expect to happen from here on out, and for the next events as well. Any other questions today? Well, I want to thank you all for continuing to cover this, and thank you as well. We will see you all next Thursday, unless we have reason to get with you sooner than that. Everybody, please be safe out there. Be patient and check on your neighbor. It's critically important that we do that. And then let's work as best we can together to get through this weather event. And we know that that's not going to happen before Sunday. So we still have a couple of 3 days to go. And I'm optimistic that we're going to get through it and get these systems repaired just as soon as we possibly can. But I do need everybody to please be patient and understand that if you're out there too early and you put yourself in harm's way, then the first responder is being needlessly put in harm's way in order to come out and try to render assistance to you. So let's be patient, let's be good neighbors, and we'll see you next week. Thank you.